All right, everybody. My name is Bascou. I was, like he said, a neurology resident at Johns Hopkins. I gotta say, it's great to be back here at the KTRN. I don't think I've been here since 2020, and it's been quite of a journey. I'm excited to see all the progress that's been made. So I did most of my work at the University of Pittsburgh with Maria Escobar back in 2017. The studies were a lot of natural history studies, the infantile, late infantile distinction. Did a lot of work on those. And then also stem cell transplant for late infantile disease. And I gotta be honest, a disclaimer here, this study is in progress. So a lot of we'll be talking about the design of it, some of our early responses that we're getting back from the survey. So as you can see, the title is Disease Burden in Infantile and Late Infantile Krabbe Disease, in which we're comparing the outcomes and responses and disease burden between individuals who are transplanted and not transplanted, specifically looking at caregiver burden. Figure out how to click this. Okay. All right, just a disclosure, the Rosenthal Family Research Foundation has generously provided the funding for this, so thank you so much, and thank you for organizing the KTRN. All right, getting into the background, the rationale for a study. So as Dr. Kurtzberg was going on about earlier, there's been numerous studies on stem cell transplant looking at prospective, retrospective outcomes, looking at neurodevelopmental outcomes, especially with the Escobar papers and the Wright follow-up paper in 2017. And then the Yu et al. Paper in 2021 that used a similar design with neurodevelopmental outcomes, but was looking at late infantile. However, there's no studies right now that assess the hematopoietic HSCT from the perspective of the caregiver. And if you highlight the 2023 meeting for the newborn screening, this was actually the impetus for our study. They had quoted specifically there that there was no studies evaluating it, and you can't really confirm that you're having positive outcomes from the perspective of the caregiver. That was the impetus for the study, but now we have the approval from Russ. This still, however, holds a lot of impact for these state level screenings. They still have to make the decision to incorporate it. So, this is really a hot topic. There's been increasing focus on the patient experience data and designing clinical trials. What is meaningful for the family? Okay, great, they're now able to pinch their finger together, but what does it actually mean? Okay, they're now able to get up and walk. The nerve conduction studies look like this. All this is great, but how is the family really being affected? Is it meaningful? So our study is going to systematically evaluate this. We'll look at the daily struggles. We'll look at how the caregiver is actually tolerating what they go through. And we're going to implement this data to basically help educate healthcare providers, since Krabbe is such an esoteric disease, very rare. Most pediatricians have not seen it, and also for insurance companies, payers, so they have a better grasp of the significance of transplant and also newborn screening. And what I really think will be helpful too is making the decision to transplant your baby. It is not a trivial decision, especially when you don't know what the significance of your variant is. You've been told that they have, this mutation, Y319C mutation. Should we go ahead and transplant? Okay, the data says this, but what are people who have actually been through it saying? All right. God, I should not have brought my computer up here. All right, so what is our question? The caregivers of infantile and late infantile disease who have undergone transplant have better outcomes in terms of their burden, their quality of life, their financial struggles, their emotional struggles have improved outcomes compared to those who were transplanted late or not transplanted at all. Just to lay this out one more time, very directly, our objectives here are to assess the impact of stem cell transplant on disease burden, quality of life, family function, depression, financial stressors, and hopefully uncover significant differences between those who were transplanted and not transplanted or transplanted late. And we're going to fill in this gap in the literature that they reported at the newborn screening meeting back in 2023. We're going to do this with a lot of qualitative data, but we're also going to incorporate quantitative data. So Tom Ligon's leukodystrophy quality of life assessment will be aided as well. And then the other big thing, that's kind of a secondary objective here. Ask any parent of a child with Krabbe disease, and what do they often tell you is their first presenting symptom? Well, I don't know. They were just irritable. They kept on crying. I couldn't do anything to make them stop crying. When I was doing my natural history studies, we heard that over and over again. We couldn't decide whether or not to incorporate that as a first symptom, as the initial symptomatic characterization. It's hard to differentiate that from colic and other disorders. So really, if we can get a better grasp and a better understanding of this, we hopefully can differentiate irritability that is a true symptom of Krabbe disease and is something to worry about and can help initiate movement into the stem cell transplant or gene therapy instead of just misinterpreting it for colic, as can often be dismissed. So our design, non-interventional, qualitative study, we use mixed and open, closed-ended questions. It is approximately a 90-minute survey. So we get some demographic data, we reach out and then schedule it, then we do this 90-minute survey. The questions are designed specifically to allow the respondents to elaborate upon the burdens. They can use their own words. It's amplifying what is most important to them. And then for our quantitative data, we're using the leukodystrophy quality of life assessment, and then the EQ5D, the EQ5D, 5L, which is looking at mobility, self-care, usual activities, pain, discomfort, and depression. So our research targets, we hope to get a total of 100 questionnaires, that first part, and then out of that, we'd like to get a total of 40 people who complete the 90-minute interview, divided between 20 who are not transplanted or transplanted late, and then 20 who have been transplanted. I'll just go over this slide pretty quickly with our inclusion criteria here. But any patient or a family member who has infantile or late infantile disease, and then the one big exclusion criteria that we have is you cannot have your child pass away within the past 5 years, just to avoid recall bias. They have to have proof of disease. Proof of disease can come from a healthcare provider, and we also would like to have at least one piece of biochemical evidence, including cytosine, mutation analysis, or Gaussian level. Ideally, more than just one. And just an overview of our process for the participant involvement. We send out an email from Krabbe Connect or other advocacy groups who have a Krabbe Connect approved email, and then they RSVP for it. We go through the surveys, we answer the questions. Engage Health, who we're working with, will then go ahead and obtain the documentation for proof of disease, and then we go ahead and schedule the interview. So as for just some examples of our survey, it's a very long survey, over 100 questions. So I just got a couple screenshots here. This one is specifically looking at how physically demanding the burden is for the caregiver. So lifting, bending, that type of stuff. This is a place where I actually am interested to see if people who were transplanted actually have a larger burden. If you think about the survival, imagine an 18-year-old who has no peripheral nerves but has a full central nervous system, like you often see in stem cell transplant. It could actually be more of a burden on the parent than somebody who's not transplanted. Just another example here is basically how emotionally demanding are your life? What are the top 3? Is it changing the G-tube? Is it changing the baby? Is it taking them to all of these separate appointments and hearing different conflicting evidence from different doctors? Educational activities. It's a full-time job caring for somebody with Krabbe disease. You often feel that people have to drop out of college, they'll have to change their jobs, and we would like to hear about that. And then some financial issues too. As you can imagine, the care is very expensive. Insurance will cover a lot of it, but there are often times when you have to fight with the insurance companies, do peer-to-peers from the physician standpoint, and travel, food. There's a lot that goes into it. And also just not being able to work. Now, we also aren't just going to ask about the caregiver, but ask about how these symptoms are progressing within the patient themselves. So, I won't go into too much detail here, but feeding, neurological issues, spasticity, gauge that. That is something that we also did in our natural history studies too, but just digging into more detail. And this is what is interesting to me. So we're going to have them list their 3 top burdens. It's open-ended. We'll do it at the beginning of the study. And then after going through the rest of the survey, thinking about these questions, we'll then answer the 3 questions again, see if it changes after introspecting. This is also something that I believe will be very helpful for designing clinical trials too, in terms of just determining what is best from the patient standpoint and what is causing them the most trouble in their life. All right. So we do have some responses so far. I want to read them to you. Some of them are moving. So if you look at the top right there, that is from an infantile baby, coming from a parent. Looking at the 3 things that are the largest burden in their life. Not being able to work, keeping up with specialists, lack of help. Makes sense. From the same person, at number 91, we're asking her about the relationships. So here's their response. We started couples counseling when she was 9 months old because we knew that somebody like this can have an impact and we wanted to get ahead of it. What was the most valuable thing we could have done? Feeling lucky we were able to find somebody, it has helped. Yeah, and that makes sense. This family chose to get ahead of it. And it seems like it had a good benefit. Now at the bottom, looking at some of their burdens, a 0 to 10. You know, we had COVID recently and starting to find a lot of trends in COVID causing struggles. So let me go ahead and read this one for you. When she was sick during COVID, it made everything even more difficult. I had one part-time caregiver starting at a year old, and we got approved for nursing hours. However, we were never able to interview anybody. Nobody ever came. Most agencies had wait lists, but we're not accepting new patients. I was caregiver 24/7. I couldn't have work even if I wanted to. Last 6 months, I was able to get paid, but it was a big hurdle. Was not eligible for disability. Those are all from the same patient. Now we'll go ahead and look at the other side. This is also from an infantile patient who was not transplanted. Looking at their burdens, making sure I did everything right. Man, it's got to feel guilty. It's got to feel a sense of guilt even though you did nothing wrong. Your baby's sick, but there's nothing you can do. Trying to keep him alive, what a struggle. 25-year-old trying to keep their baby alive. That's all they worry about day and night. And then worry, of course. Looking at their responses, what was the first thing that happened that brought the patient to the doctor? This question is important. How many times has a baby been brushed off as, they're just having colic? That's not irritability, that's not a neurological disease. And this is their response. He was my first child. Looking back, I should have questioned him more. He was having tremors in the hospital. They said it was just newborn jitter. I have a history of seizures, so I was worried, but I let it go. We got home and saw that occasionally, and 2 weeks later, he started jerking his whole body, followed by screaming and crying. That 2 weeks right there, that could have made the difference between a transplant and a not transplant. If we had better understanding of irritability, maybe we would have known. This one really gets me. Attempt to quantify, ask the patient for this severity of the burden, 0 to 10. This person said 10. I think you'll see why. Trying to keep him alive. Our neurologist told us that it was fatal and he did not qualify for a transplant. Dr. Escobar saw us for 3 days and laid it all out for us. Had the G-tube in Pittsburgh due to their experience at Krabbe. I wanted him as long as I could have him. I was never sure if he was going to wake up. He happened to be awake when he passed. No sign it was coming. He had been sick with a virus. He got better for a week, then passed. Rating a 10, emotionally. All right, and the last one, number 91, again from the same patient, how it affects your relationships. Had stronger family and husband relationship, Didn't see others due to COVID, so it was different. We went through the worst possible thing, and we made it. We vowed it would not break up. Family was really supportive. Sister-in-law moved in, and patients came with groceries to clean. That's from the same patient who passed. So, out there, you have all these blogs, right, of family members telling their story. That Y319C, there's a whole blog about the nightmare that they went through. This data is just not systematically collected, just, people telling their stories, telling their narrative. Our study here is a way to collect that systematically and really consolidate it, to look for themes, and to express this to the medical community. Give it some legitimization. That's what we're hoping for. Just looking for the clicker. All right, so as I said, this is a study in progress. We have been working on recruitment. This data is out of date by about 2 days. So far we have a total of 13 surveys. We have 11 people who have been scheduled for an interview or have interviewed, and we have a total of 5 that are completed. Predominance of it so far is in individuals who have not been transplanted. We are looking for more people who have been transplanted. So just our team going through, we have Stacy Pike, who's my co-PI, founder of Krabbe, and myself, Dr. Orchard, and the rest of the team. Also, Dr. Matern's been a great resource and has provided us with good guidance, and of course, Dr. Escobar. That being said, if you are interested in helping out with advertising or just getting the word out there for our study, feel free to reach out. Our emails are right there. Thank you.